Okay, so the first question is, what is RPM and what is CCM, and what are the similarities and what are the differences? So basically, it's pretty straightforward. They're both programs that Medicare is paying for the physicians to monitor their patients from home under supervision by a medical staff, but it is not necessarily in-person care or telemedicine care. So telemedicine care or in-person care is where you are actually diagnosing a patient, changing the treatment plan for a patient, or issuing new prescriptions for that patient. You're doing an actual medical assessment or change to that patient's protocol. But with RPM CCM, both of those programs are simply monitoring. So this is Medicare's reimbursement for just the monitoring portion of the care. The difference between RPM, which is remote physiologic monitoring, and CCM, which is chronic care management, is that with RPM, there can be a number of different vitals or data that the physician would like to collect from the patient. Maybe it's sleep, maybe it's oxygen, maybe it's glucose. It could be anything. So remote physiologic monitoring is just collecting that data. And that can be for any patient that is a Medicare patient. They will reimburse you for collecting it. With chronic care management, the patient has to have 2 or more chronic conditions that they've been diagnosed with. I mean, there's a long list of those which we can reference for you, but any 2 conditions chronic qualifies a patient for the chronic care management program, which means that the patient is going to receive a care plan, a patient care plan according to the conditions that they've been diagnosed with, and that the physician staff will be overseeing the implementation of that care plan for the physician remotely with the patient. And so now both codes require 20 minutes of patient interaction, with the exception of the RPM code, the first RPM code, and we'll go through the codes in more detail on a different video here, but this is just the overview. With the exception of the first RPM code, which is just for the collection of the data. The second RPM code is for the 20-minute interaction, and that's where the patient care is actually taking place. And the chronic care management program code requires 20 minutes of interaction with the patient as well to oversee that care plan. And that's monthly. It's important to know that only one provider can bill per patient per month these codes. So there is a bit of a urgency to get to your patient base and become that primary remote monitoring physician for the patient so that Medicare reimbursement will come to your practice. If you understand the differences between RPM, CCM, and telemedicine, then you can understand how they work together really well, because what happens is when you have a staff, and this can be as simple as an MA that's under your supervision or under our company's supervision, depending on how you set up your plan, that MA is going to be monitoring and along with the help of the software, they're going to be monitoring the patient and watching for any type of issue that may arise. And if and when an issue arises and the patient status is elevated to medical to a recommended state of medical intervention, that's when you will go ahead and have that telemedicine visit with the patient or have them come into your office. So right now, obviously, there's a lot of telemedicine, a lot of preference for telemedicine, and Medicare is actually increasing their reimbursement program for telemedicine. So that shouldn't be a problem at all. And our platforms, we have several platforms, but we can set you on a platform that actually integrates seamlessly from your remote monitoring into your telemedicine program.